That is androgen-dependent alopecia. Okay, but translated to normal English is pattern hair loss. Reducing DHT should increase hair growth because of the negative impact that DHT has on the hair follicle. The major player in this whole story around inhibiting 5-alpha reductase and reducing DHT to maintain or increase hair growth is going to be finasteride and its close cousin dutasteride. Finasteride is effective in reducing DHT because of its actions in reducing the type 2 isoenzyme or isoform of 5-alpha reductase. And in doing so, it can increase hair count by as much as 20%. Pretty remarkable if you think about it. In addition, finasteride treatment done properly, which we'll define in a moment, can reduce hair loss in 90% of all people that take it. So that is, near staggering. There aren't many pharmaceuticals out there that have that kind of efficacy, really dramatic. And in addition, it's known to increase hair thickness by about 20 to 30% overall. So not just create new growth of hairs and thicker hairs, but whatever hair you do happen to have on your head, it can further thicken those. So the issue with finasteride is twofold. First of all, it is known to have some pretty significant side effects if it's not dosed properly and in particular populations of people. I also should point out that finasteride comes in two major forms. There's an oral form and there's a topical form. So this is not unlike our discussion of minoxidil earlier. Topical finasteride is typically taken in 1% solution or ointment and rubbed into the head. Sometimes it's now also incorporated into shampoos, but typically it's put into a solution that people rub into their head. And it is thought that the 1% solutions are equivalent to 1 milligram of systemic finasteride. The issue is also that topical application of finasteride is harder to dose than oral finasteride. I'm not saying you should be taking oral rather than topical finasteride, but keep in mind that the dosages of finasteride that have been shown to be effective for inducing hair growth cover an enormous range. So as low as 0.01 milligrams per day and as high as 5 milligrams per day. Now, in trying to simplify the problem of how much finasteride to take, either by way of oral tablet or by way of topical solution, we can get a bit of leverage on this by thinking about how much DHT reduction occurs as a function of dose. And there, finasteride shows this really interesting, what's called logarithmic distribution. What it means is that for a dosage of 0.01 milligrams of finasteride, you're going to achieve approximately 50% reduction in DHT. And that's systemic DHT. So this is a blood draw measuring your DHT, then taking 0.01 milligrams of finasteride. Again, 0.01, very low dose of finasteride for a period of a couple of weeks. Measure people's DHT in their blood again, and you see that it's reduced by 50%. However, at increasing dosages of 0.2 milligrams, 1 milligrams, 5 milligrams of oral finasteride per day over the same period of time, the increase, or I should say the reduction in dihydrotestosterone doesn't increase linearly. It's not that you go from 50% to 60% to 75% to 100% with each increasing dose. It tapers off. It kind of flattens out. It tends to increase a little bit, but it's sort of a gradual slope increasing as you head from 0.2 milligrams out to 5 milligrams. So what this means is that given that reducing DHT can cause various side effects, sexual side effects, reductions in either sexual function or sexual drive, as well as overall drive and motivation, sometimes even some depressive symptoms, that everything points to taking the lowest effective dose of finasteride and starting with a very low dose of finasteride, because low doses of finasteride, even at that 0.01 milligrams taken orally daily, are already leading to a 50% reduction in dihydrotestosterone, and thereby, taken for a long enough period of time, should offset hair loss and stimulate hair growth.